My name is Melanie Dodd, and I am the Associate Dean for Clinical Affairs and a professor in geriatrics at the University of New Mexico College of Pharmacy in Albuquerque, New Mexico. So I originally attended Purdue University, where I completed a Bachelor of Science in Pharmacy degree, and then became licensed as a pharmacist and decided to go back to school and completed a Doctor of Pharmacy degree at the University of New Mexico College of Pharmacy. And then after completing my PharmD degree, I went on to complete a pharmacy practice residency program at Presbyterian Health Systems in Albuquerque. When I was a high school student, I had an amazing organic chemistry teacher, which I just loved. And I knew that I wanted to follow in a health career of some sort. I had worked at as a candy striper, a volunteer at the hospital that I was actually born in, and was able to work at the nurses station and do a variety of things. So I'd been introduced to a little bit of direct patient care. That in combination with loving math and science led me to think, okay, I really want to go on and be a healthcare provider. At the time, I thought that I wanted to pursue a medical degree, and I was advised at the time that pharmacy would be a great pre-med career or stepping stone. So I got into the pre-pharmacy program and got admitted to pharmacy school. And once I was in there, I was hooked and I loved it. And I'm like, no, I want to be a pharmacist. I love the opportunities of being able to optimize medications for patients and to use those basic science skills that pharmacists have in terms of pharmacology and pharmacokinetics, and putting all those pieces together to really guide and to be able to manage medications for our patients and the various chronic disease states, et cetera, that our patients have using those skills. Once I was into pharmacy school, I knew I had found the career that would be my career probably for the rest of my life, and that has held true. As a faculty member, I wear a variety of hats. In my clinical practice, I work as a pharmacist clinician, which is an advanced practice license with prescriptive authority that's unique to the state of New Mexico. And in that capacity, I work out of our University Hospital Senior Health Clinic, and I work with older adults in an ambulatory care clinic and have the opportunity to work with them to manage medications as well as to manage their chronic disease states, including things like diabetes and hypertension, as well as the spectrum of geriatric syndromes that our older adults encounter as they age. So things like dementia and urinary incontinence and a whole variety of different things. And many times they walk in the door with not just one chronic disease state, but multiple chronic disease states and are taking many, many medications. So it's a great opportunity on those days that I'm in clinic to be able to work with our interprofessional team, our physicians, our physical therapists, our social workers, our nurses, to be able to co-manage those patients, and again, to optimize those medications and optimize their disease states to help get them to goal. And many times I have the opportunity to not only prescribe, but also to de-prescribe and help to minimize the medications that they're taking, which many times may be causing some of those side effects because, in a little bit of tongue-in-cheek, as the good pharmacist says, everything's drug-induced until proven otherwise. So many times taking that opportunity to minimize unnecessary medications. I'm also in the classroom. I teach the geriatric content in our Doctor of Pharmacy curriculum at the University of New Mexico College of Pharmacy from our P1 year through our P4 year. So I'm teaching in a variety of different classes, including our integrated pharmacotherapy series, and teaching a number of those chronic diseases that I manage in the clinic as well. And I also teach in our law curriculum as well, where I have an opportunity to really share not only regulatory components and talk about policies and some of the things that I do with ASHP within our House of Delegates in advocacy. So I'm in the classroom in a variety of different places. And then also wear an academic hat as the Associate Dean for Clinical Affairs, where I have the opportunity to oversee our various clinical practices that our faculty provide within the college, and get the opportunities to work with leadership within the health system and across the state and across the country to really help to push the practices. We work on things like billing for pharmacists and provider status and being able to operationalize a number of those things. And I also oversee a small consultant team within our college, so opportunity to work with a number of health systems within the community. And to place our faculty in different places and work on contracting and a variety of different things there. So no day is the same as I wear those variety of hats. And certainly a thread that goes throughout all of that is scholarship and how do we demonstrate what we are doing, not only in the classroom, scholarship of teaching, but also scholarship of practice, and being able to demonstrate the outcomes and the improvements that we're making both in the classroom as well as in clinical practice. It's hard to pick one particular component of my job that is my favorite, but I absolutely do love my patients, their families, their caregivers that I get to care for. But I equally love the students and the learners, the residents that I get to work with as well. So many times those days that I'm in clinic is the perfect combination of both, because I have my learners with me as we're caring for those patients. And so those are definitely some of my favorite moments. But at the same time, I find this great joy in being able to work on policies and the advocacy side of things as we push the practice and work with our legislators as well. So it's hard, which is part of why I love my job, because I do have a variety of different things that I have the opportunity to do. I would urge anyone who loves patients and caring for people, that has an interest in the sciences areas, that enjoys putting those two together, to really consider a career in pharmacy, and to recognize that careers in pharmacy are so broad and so different, and there's so many different practice environments where we can be. We may be in the community settings, in the more, what we see as the public, the more traditional roles, in a more retail type setting, but we're also working in hospitals and health systems. We're working in ambulatory clinics, in physician offices. We're working in consultant roles. We're working in nursing homes. We're working in nuclear pharmacy, and in so many different ways that we support our patients and have this tremendous opportunity to be a part of this much broader interprofessional team. And we come as the medication experts to care for those patients, which nobody else has that breadth of skill set as they come to the healthcare team. So definitely, if you have an inkling and that love of science, that love of math, and that love of caring for people, I would absolutely think about a career in pharmacy, because you're going to have so many opportunities and career choices with just that entry-level degree.